Summary of initial consultation needs analysis for a new client. Screening processes are designed to ensure the safety of exercise programs. It may also enhance patients' motivation by reducing fears of injuries and promoting feelings of competency and mastery to engage in the recommended exercise. Therefore, the pre-exercise health screening for the client was done before the exercise prescription. This presentation will start with interpreting the new client screen form, initial consultation form, and pre-exercise screening tool. These tools evaluate the client's medical history and current physical activity status, determine the client's readiness to perform physical activity, and provide the client's goals. From these tools, a recommended exercise plan will be provided. Here shows the information collected from the new client screen form. The client is a female, 165 cm tall, weighs 64.45 kg, and thus generates a BMI of 23.67, which lies in the normal range. The blood pressure reading is 134/92, lies just in the high blood pressure category. Her current physical activity status is below recommendation, according to the physical activity guidelines from the Australian Government Department of Health. She has been diagnosed of costochondritis and was prescribed with pain medication. Her exercise is not limited by this condition. In stage 1 of the essay pre-exercise screening questionnaire, the client answered no to all 7 questions, which indicates that she may proceed to undertake light to moderate intensity physical activity. In stage 2 and 3, it shows that the client is a non-smoker, undertakes more than 150 minutes of physical activity per week, has normal BMI, cholesterol, and blood sugar level. No recent hospitalization, prescribed medication, or birth giving. No muscle, bone, or joint conditions that will be exacerbated by exercise. These all indicates that she has no risk factors. However, her diastolic blood pressure is about 90 mm of mercury, which indicates a risk factor. In the Fantastic Lifestyle Checklist, the client gets a grand total score of 78. This means that she has a very good lifestyle, but there's still space for improvement to achieve an excellent lifestyle. In the Part Q form, the client reported experiencing chest pain when she was not doing physical activity in the past month. As mentioned before, she has sought advices from physician and confirmed that she can exercise normally. She answered no to all other 6 questions, which means that she can increase her physical activity levels safely. From the initial consultation notes, we knew that the client is a full-time student working part-time 3 days per week and has no exercise limitation. She used to participate in competitive touch and netball as a center. She also did leisure tennis, softball, volleyball, and swimming. Currently, she plays 30 minutes of leisure touch once per week of moderate intensity and 30 minutes of light exercise every day. The client's health-related goal is to change her body composition, be more muscular toned, and lose body fat. For behavior, she aims to perform 5 sessions of moderate exercise for 30 minutes each week and a 30 minutes vigorous session at least once per week. Her exercise-related goal is to return to competitive netball in 6 months to 1 year time. To do that, she aims to work on agility and leg power in order to prepare the joints for the extreme impact that the sport requires. Home program is preferred. A needs analysis of netball has been done for the program designed for the client. Centers complete a greater amount of short recovery, high-intensity multidirectional movements that are likely to stress the aerobic energy system. In addition, sprint ability appears to be particularly important for centers. Centers have to constantly change direction and activity mode on average of every 2.8 seconds. Therefore, they must have good agility. It was reported that better leg strength and stretching exercises had contributed to better agility and therefore improved netball performance. Moreover, better jumping ability can also improve the catching of high balls and rebounding. Several tests should be done before prescribing exercises to the client. The client should undertake agility test and leg strength test first to understand her initial agility and leg strength ability. Sample agility run test and vertical jump test may be undertaken. As one of the client's goals is to lose fat mass, skin fold tests may be done to monitor fat mass loss progress. For exercise programs, the client may implement strength endurance training to improve aerobic fitness. Moreover, it is recommended that repeated sprint training is included in their training to appropriately stress the phospholipids system. Acceleration training can also be used. To improve agility, leg strength and power training and stretching exercises have been shown to be effective. Moreover, leg strength and power training can also result in a better jumping ability, which is beneficial to netball performance.